So ma'am, like men, what are the other investigations and problems in women we can notice, ma'am?
So if we now talk about women, so women, we divide the causes into uterine causes, tube related causes, ovarian causes or ovulation related causes. And the other causes like medical issues like thyroid, diabetes, or any other autoimmune diseases like SLE, rheumatoid arthritis, all that can also affect fertility. So we will start with the uterine factors. So uterine factors, basically there can be many uterine factors which can either cause subfertility, which is reduced fertility, or can cause miscarriages or other issues also, wherein they need treatment for continuation of pregnancy if not for conceiving. So what are the uterine factors? So there can be congenital, means since birth some factors, or there can be acquired, means some disease or something which has come after birth, during your life you have acquired that. So congenital causes can be even absent uterus. So there's some syndromes which we call Mayer-Rokitansky-Kusar-Hauser syndrome, where the uterus and tubes are absent. Most of the time such patients will have ovaries, but uterus and tubes are absent. So there can be a complete absence of uterus. There can be other anomalies of development of uterus, like a very small unicornuate uterus we call, rudimentary horns, means they are so small that they may not be able to have the pregnancy.
So ma'am, now everything we have discussed, so it leads to systemic diseases also. So at the very young ages, people are diagnosing with thyroid, diabetes, everything. So how can these affect the fertility problems, ma'am?
So thyroid can make you put on weight, extra weight. So as the weight increases, your body fat, if it is increased, the hormones of the body also change. In thyroid, like hypothyroid, usually what happens, the period irregularity starts. Also, it can affect ovulation. Egg is not being released on time from the ovary. Thyroid disturbances can cause menstrual irregularities. It can cause heavy bleeding in the periods. It can also, if you become pregnant with thyroid issues, there also might be increased risk of miscarriages, preterm delivery, even getting blood pressure during delivery. So all these are related to thyroid. Then polycystic ovary patients, they are at higher risk of developing metabolic syndrome, we call it. So it includes like problems with lipid profile, that your cholesterol is high, your triglyceride levels are high, or you develop hypertension at younger age, you develop cardiac complications because of high cholesterol and high blood pressure. Then they also have a tendency to develop diabetes early also in life, the polycystic ovary patients. Also, if they don't develop diabetes before pregnancy, there's higher chances of what we call gestational diabetes to these patients. So all these PCO and thyroid patients, they have to be very vigilant about their weight and about if they are developing any of these conditions, because all of these will require treatment even for their health other than the fertility. So these are the issues which are associated with thyroid. And
So ma'am, earlier the menarche and menopause used to be come at the later ages,
right,
but now these days at 10 and 9 years also it's coming. So what might be the reason, ma'am, that can cause any effect on fertility?
Early menarche as such should not affect fertility, but all the babies, female babies, they are born with a fixed number of eggs. So by the time puberty or the menses start, this some lakhs of eggs are already destroyed, like already they're gone from the ovary. So during your reproductive years, that is once you start your periods, menarche till menopause, you ovulate around 300 to 500 eggs. So that is the fixed number. So if the menarche is earlier, so you may exhaust the egg reserve also earlier. But another important thing is why menarche is happening early means, again the same thing, because of the lifestyle changes. There are many what we call endocrine disruptors in our food, which are chemicals, because of maybe use of hormones or antibiotics in the milk what we use, or in the meat that we eat, or the eggs what we eat, or even the pesticides which are used in all the agricultural products like your grains, your vegetables. So completely organic life is not possible. So it's like we have the exposure. So all these endocrine disruptors can affect your fertility. Then they can cause early periods. Also nowadays, because our food habits have changed, so they say high calorie food or very rich food can cause early start of menses. So it also depends on how much body fat you have. So somebody who's little bit on the plumpier side will get menses earlier. So it's very important for young girls to be physically active and their mothers to understand nutritionally what is good for the children. You should not feed your children with very high calorie food. Try to avoid as much as possible the exposure to these chemicals if you can have access to organic food, or if you have access to dairy products which are not being treated with these things, then that can help. But if it starts early, then definitely even for the height growth there can be a problem. So physically, if you are active, if your BMI is near normal, I mean the child's BMI is near normal, if the child is physically active, then you can have maybe little bit delayed menses, and also height will not be affected, because as you start getting periods, there will not be growth of height after that. For maybe after 2-3 years it will stop the height increase. So all those things the mothers also should be taking care of.